Good afternoon, and thanks for joining us for Living Local, your lifestyle show for everything Charleston. I'm Ashleigh Messervy. Today, we're here at the Dermatology and Laser Center of Charleston to get down to the nitty-gritty about skin cancer and why early detection is key no matter what your age. So you're actually a current patient here at the Dermatology and Laser Center of Charleston. How did you come across it? How did you find out?
Well, I have a family history of skin cancer and would go in for screenings every year. And we found a spot, you know, Dr. Schlesinger always says, if anything new you've noticed, and I said, well, there's this one little spot, you know, but I really didn't think it was anything, and it turns out it was melanoma. He called me himself on my cell phone. When your doctor calls you himself, then you know something's up. I know, I was like, oh my goodness, you know. But yeah, so he said, no, it's in situ, so it's very early stages. Just come in and let's sort it out.
We're going to talk with your doctor, Dr. Schlesinger, and he's going to give us an idea more about the types of skin cancer and what you can do to be proactive, just like you were. Okay, joining me now, Dr. Todd Schlesinger, and we're going to talk today also about the types of skin cancer. First of all, let's start with that.
So there are three main types of skin cancer. Basal cell carcinoma, squamous cell carcinoma, and melanoma. The most common is basal cell carcinoma. It occurs over 1 million times a year.
Wow.
And that one is comes from the little bit deeper layer of the top layer of the skin. That's why it's called basal cell carcinoma. Okay. It usually doesn't spread to other places, but if it gets large, it can become dangerous.
Let's talk about some of the places that you wouldn't even think about that you would get skin cancer, that you've, maybe some of the places that you're like, wow, I haven't seen that in a while, or...
Right, so have you ever heard the Bob Marley story?
No, I haven't.
So Bob Marley had a skin cancer on his foot. And that was a place that we typically don't think, especially in our darker skin patients. But it's something that's very important for us to think about. Skin cancers can really occur almost anywhere in the body. There really isn't anywhere on the body that you can't get one, even inside the mouth or around the eyes. It can occur anywhere. So the common areas that are not so common are fingers and toes. Okay. The nails, for example, a dark streak in a nail, that could be a sign of skin cancer.
Okay.
On the bottom of the foot, between the toes, in the genital area, behind the ear, in the scalp, where it's covered by hair. So those are kind of examples of places where skin cancer can occur, but that most people wouldn't think to look.
So May being Skin Cancer Awareness Month, what are you doing here to bring more awareness?
So Monday, the first Monday of May is Melanoma Monday, so that's very important. What we're doing is we're doing 2 skin cancer screenings. We're doing them on May 1st and on May 15th. The May 1st skin cancer screening will be right here at our 2180 Henry Tecklenburg Drive location. And our other skin cancer screening, that's free as well, is on May 15th. We'll be at our 1364 Ashley River Road location in West Ashley.
All right, and one last thing we need to reiterate, as far as skin cancer and the whole realm of cancers, where does it fit?
So skin cancer is, now if you combine all the skin cancer cases that are occurring every year, they are more than the colon, breast, prostate, and lung cancers combined.
So those statistics, even more of a reason why you should go to dermandlaser.com for more information on May, which is Skin Cancer Awareness Month. First off, let's talk about some of the things that you could be looking for while you're just, you know, getting dressed or going throughout your day, like that may or may not seem like something you should really even pay attention to.
So I always tell my patients to watch for the ABCDEs. It's just kind of an easy thing you can remember at home. So A stands for asymmetry. If you cut any of your moles in half, you want them to be really nice and equal on both sides. You want the borders to be nice and smooth, not jagged and irregular. The biggest thing to me is color. You want the color to be nice and even throughout, or you want all of your moles to pretty much be the same color. I always look for ugly ducklings. If one kind of is out of place, it doesn't look like the rest. It has irregular colors within that mole, like a red, a white, a black, or a brown.
So black is the one I've always heard.
Yes, black's really concerning. We do have white melanomas too sometimes, so that's why it's important to see a dermatologist. You can as well. Most of them are black, but there are amelanotic melanomas as well.
Okay, and is there any other tips you want to give people out there as far as staying protected with their skin and being cautious?
Sure, just, you know, we live in a gorgeous place, and a lot of people do want to be outside, and we want you to have a great quality of life. We don't want you to stay inside all day, but just remember to protect yourself. Wear your hats, seek shade when you're outside. Try to avoid being outside between 10 to 4. So go out early in the morning or later in the afternoon, and wear your sunscreen every day. Just, if you brush your teeth every day, I say make it part of your daily habit. Put your sunscreen on before you leave the house. It's just something everyone here should be doing.
Dermatology and Laser Center of Charleston offering 2 free skin cancer screenings. May 1st will be held at their beautiful location off of Henry Tecklenburg Drive, and again on May 15th at 1364 Ashley River Road. Now don't forget to register. You can do just that by visiting their website, dermanlaser.com.